Dereta, dereta, dereta. Stop, stop, stop. Okay, okay. Hop, 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 hop. No le mueva. Asparagus.
Hey guys, what's up? It's Stephanie and welcome back to my channel. So in the video today, I want to talk about having to learn my pathophysiology. So for those of you who are new to my channel, welcome to my channel. I'm currently a second year clinical student, so I'm currently in my clinical rotations. Well, right now because of COVID-19, I'm not in my rotations, but technically I should be. I already completed my first year, my didactic year. So basically your first year is basically a lot of book work. You learn about the pathophysiology of diseases, you learn the anatomy and physiology, you learn clinical medicine, pharmacology, clinical lab science, etc. So you learn a lot during your first year. It's, I think, the most difficult year so far, and I'm about to complete my clinical year, so definitely it was the most difficult year because you just have so much information being thrown at you and you're literally trying to survive, or how they say, stay afloat. And so I think your first year is your most critical year in PA school. And I can say that from experience, and this is why I decided to make this video, is that I've seen that I've had to go back and relearn a lot. If you haven't seen my previous videos, my first semester I struggled a lot, and I felt like my first semester I was struggling a lot to keep afloat, and I was doing the minimum, and that really affected me a lot, and it's affected me till now, especially during my clinical rotations. So I didn't learn the information like I should have learned it. And during my first semester, for example, I had the topics that we covered were cardiology, which is like a huge component of the PANCE exam, which is a national certification exam you have to take when you graduate from PA school. So a huge portion of that exam is cardiology. So you want to make sure that you have a strong basis in cardiology. And also neurology I had during my first semester, and then I had oncology and hematology. And so I really struggled during that semester. One of the classes that I struggled a lot with was my pathophysiology class. So pathophysiology is really important. What is pathophysiology? Basically, you're learning about what causes the disease. I mean, you can know what the disease is. For example, diabetes, you know you treat diabetes with insulin, right? But what is diabetes? What does it do in the body? How does it affect the body? What organs does it affect? What hormones does it involve? Etc. So it's basically the pathophysiology, is that you're learning what it does to the body. And this is something really important you want to grasp during your first year, because it's going to help you a lot during your clinical year and help you a lot also when you're practicing. I found out that a lot of patients, like for example during my psychiatry rotation, thankfully I felt like psychiatry was one of my strong I would say segments. During my didactic year I did really well, and I felt like I understood the pharmacology and the pathophysiology really well. So for example, during that rotation I had a lot of patients that had questions about the medication, because sometimes the doctor would just hand me off with the patient, and I had to do all the patient education. So of course the doctor would prescribe them a medication, and then he would tell me go and talk to them because they have questions about the medication, or how it works, or what does it do, what are the side effects, or what is the diagnosis that you gave them, what is the diagnosis in your body, what is it doing, because they don't know. Like say you diagnose them with schizophrenia, for example. Well, that's a huge diagnosis, and sometimes they would ask me, well, what is schizophrenia? What does it do in your body? Does it mean I'm crazy? Or why are you giving this medication to me? So this is where your pathophysiology, for example, comes into play. I would sit down with them, and then you'd see that once you start explaining to them how it works in the body, like a new patient that you just diagnosed with diabetes. Well, they know diabetes because they've heard of it, but they don't know what it does in the body. They don't know that if they don't get it under control, if they lose weight, if they have a good diet, their diabetes can get worse and it can affect other organs in the body. So they don't know any of that. They just know that they're labeled as a diabetic, and that's it. And this is where you as a provider, you sit down and you talk to them. Look, this is what diabetes is. It's, for example, glucose, which is like the sugar in your body, intolerance, and etc. And you tell them, you know what, it can affect the heart, it can affect a lot of things in your body, and this is where pathophysiology comes into play. And it's really important that you make sure that you understand it during your didactic year, because it's going to come back and haunt you during your second year, especially when you have also doctors during your rotations that are asking you questions on mechanisms and what is a pathophysiology of the disease. Like I had a doctor who got upset with me because I didn't know what was a pathophysiology of Parkinson's disease. What did it cause in the brain? And I had vaguely remembered, but I couldn't give him the correct answer that he wanted. And so this is where you have to make sure that you know your pathophysiology really well, because it's also going to help you think critically and think how you can treat the patient with certain medications and how that medication is going to make them better, and how you can give that patient education to the patient. So for example, going back to my diabetes patient, how is exercise going to help them? How is losing weight going to help them? How is taking their medication every day going to help them, and making sure that they are compliant with their medication? Is this pathophysiology? So if you're a new student that is in your didactic year, if you're about to start PA school, and of course your didactic year is your first year, make sure that you know your pathophysiology, make sure that you know your pharmacology. Pharmacology, not just memorizing and dumping, but making sure that you understand it, because it's going to come back and haunt you. There's been so many cases where I had to sit down and I have to explain how a drug works. What are the side effects of the drug? And if you know the pathophysiology of the disease and how that drug affects it, then you're able to sit down and explain it to a patient. It's really embarrassing when you don't know that, especially in front of a doctor and they're asking you the question you don't know, or the patient is asking you a question you don't know. It's really, really embarrassing. So make sure that you do it for yourself. I'm speaking out of experience. I wish I would have learned, especially my first semester, my pathophysiology better, my pharmacology better. Sometimes, especially, it was so embarrassing because you'll have doctors that will ask you, what's this drug? And I look at it and I'm like, oh, I know what the drug is, and I'll give them the name, and they're like, okay, well, what's the side effect? What's the mode of action? What does it do? And I'm like, I don't remember. I just memorized and I don't remember. So now I'm having to go back and learn all this pathophysiology again, the mode of action of the medications, the pharmacology, and get it right the first time you can. Guys, the first year, get it right. That way you're not struggling during your clinical year. You're gonna see how much is gonna help you during your clinical year. If you know your pathophysiology well, if you know your pharmacology well, if you know everything. So basically, I would have to say that your didactic year is really, really important and vital, and it's gonna set you up for your clinical year. So yes, since my first semester, like I said, I felt like everything kind of just went over my head. I'm having to go back and learn this, especially when it came down to cardiology. Now I can say that for my oncology and hematology, I've been doing really well. My exams are usually, that's like the highest part that I have really good grades in, like my highest portion in comparison to the other systems like the GI and endocrine, etc. But that's because I had to go back and learn that, especially for my pediatrics rotation. I had to make sure and learn anemia, how does the patient present with, why is the patient presenting with this symptom, what is occurring in the body. And then since I learned from having doctors ask me questions and patients ask me questions and me not being able to answer them or give them the appropriate education. So going back, for example, to my psychiatry patients, I had to do that a lot. I had to do a lot of patient education. So I was really lucky because I did really well during that block with psychology. I did well with my pharmacology, and I felt like I knew the information very well. So I was able to shine during that rotation, but I can't say the same about the other rotations. And you'll see how much more the patient feels like a lot more relaxed. And I guess just put yourself in their situation. You're giving them this new drug that they've never heard of. They don't know the side effects about it, or they've heard about the drug and they say, well, I saw on TV that it causes this, 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 this. But if you sit down with them and you explain to them what the disease is occurring or how the drug is going to cure the disease or prevent it from getting worse, etc., then they'll take their medication and they'll be more compliant with it, and they'll be a lot more grateful with you, and they'll understand it. So make sure that you, like I said, know your pharmacology, your pathophysiology. Really important during the didactic year. Just speaking from experience. Alright guys, I hope you guys liked this video, and I'll talk to you guys later. Bye.